Hi, guys.
How you doing, BZ?
So I'm Dr. Michael Brant-Zawadzki, senior physician at Hoag Hospital, and I have two of my colleagues from the Pickup Family Neurosciences Institute with me for an interesting discussion regarding a topic that's just hit the news. Gus, Dr. Gus Alva, is our director of senior brain health at the Pickup Family Neurosciences Institute, and Dr. Lauren Bennett is our director of neuropsychology services. Thanks for taking the time to be with us today. I really appreciate it.
Thank you. It's exciting to be here.
Absolutely.
You know, Gus, I think Yogi Berra is attributed with the saying, the problem with predicting the future is it hasn't happened yet.
So true.
That said, some things are somewhat easy to predict, and one of those is the aging in our population and our society.
Yeah.
So we know Orange County's population is growing by 15%, all of which is 65 and over.
Yeah.
And we also know that those seniors, about 25% of them have memory issues that are not normal, and about half of those are related to the early onset of what could be Alzheimer's disease.
Absolutely.
Just this week, we got a ray of hope. And Hoag, the Pickup Family Neurosciences Institute, you were part of the trials of a new drug that was just approved Monday by the FDA for treatment of patients with early Alzheimer's. So, Gus, I want to ask you, as a national, international expert in neuropharmacology of these disorders, is this hope or is this hype?
I think it's definitely hope. I think that this is something that's going to push the field forward in such a manner that it invigorates professionals. I think that part of the problem up to this point has been apathy. I think that without having disease-modifying agents and only palliative treatments that can slow down decline, I think a lot of clinicians kind of felt like they didn't necessarily want to step in and do more. I think that now we're going to have a greater opportunity of having involvement with people, getting checked out whenever there's questions. We know that individuals that have had a family heritability component are at an increased risk. We know the biggest risk for developing Alzheimer's disease or mild cognitive impairment is getting older. And having that tied in, anyone that's concerned can certainly look over to Lauren and say, hey, are there any tests that we might be able to do that could help us figure out whether I'm on a road towards problems or not? But we also now know that biomarkers are phenomenally useful in helping bridge whether people are at risk and an opportunity of intervening even earlier. What are your thoughts, Lauren?
Absolutely. I think the earlier we can intervene, the greater difference we can make in terms of the course of progress of the disease and also impacting lifestyle factors that will help to lower the risk even in asymptomatic folks.
So let me unpack some of the comments you've both made, because I think our audience may want to understand this a little more deeply. So these new drugs, as I understand it, Gus, attack one of the deposits in the brain, the gunk, the amyloid plaques, the tau plaques, the gunk that slows down transmission of activity in the brain and is responsible for the horrendous disease that basically turns people into shells of their former selves. And it's so stupefying to their families and their loved ones as to how that process occurs. These drugs seem to take away these tangles through a biochemical process. That said, is that definitely going to be enough to reverse the course of the disease? And also, I know that we at Hoag, you specifically at Hoag, are doing new trials on new agents. We just opened up 2 new trials. What's the difference between these drugs?
I'm glad you asked that because, you're absolutely right. At the turn of the century, a Bavarian psychiatrist by the name of Alois Alzheimer first described this condition, scooped out some brain tissue out of a woman by the name of August D. It identified the 2 pathognomonic features associated with the illness, beta amyloid plaques, that gunk, that junky stuff that you just described, and hyperphosphorylated tau. These new therapies, of which we're excited about the fact that we are, doing even earlier work, even in people that don't have any symptoms yet. These are some of the studies that we're currently involved with at Hoag, which brings an even bigger glimmer of hope for people. By the way, we have very fancy imaging, which you're very deeply acquainted with, but for our public, it's kind of nice being able to light up the brain, take a look at pictures of what's going on inside without having to crack someone's skull and take a look inside. We have ways of functionally looking at what the brain's doing, and if we know that beta amyloid's accumulated, now we can reduce that significantly, and that improves cognition, an area that Lauren's quite expert in, and function, which is ultimately what people want to get more information on. Am I going to be able to preserve my abilities even after I've been diagnosed?
So that's a very good point, Gus. I want to talk to Lauren, because you face these families maybe upstream from when Gus sees them for treatment. And so here I am. I am the son of a patient who has suffered from Alzheimer's. And I'm concerned about, should I allow my father to be part of a study? And more importantly, maybe, should I be part of a study? The predominant feeling has been until now, why should I find out if I'm at risk for having Alzheimer's? Because there's nothing we can do about it if it happens.
Right.
So you're the clinical neuropsychologist. You have the ability to talk to these folks, explain the situation to them, test them with your clinical methods, and then if they're the right candidate, refer them for an imaging study, perhaps, that shows us the gunk. But how does that interface go with those families?
I'll say the greatest barrier we have to finding a cure is participation in trials, right? So while it might be scary to an individual or a family, it's the greatest act of public service, right? So many folks that are passionate about moving the science forward will choose to also take that risk because there can be a potential positive impact for themselves, for their family members, but also for the field so that we can find a cure. That's the goal.
One other thing they'll learn, there are some behavioral changes folks can introduce into their lifestyles upstream to help either delay the onset of what could be early dementia and potentially improve the quality of their lives, even though they may end up with some form of the disease. I guess the goal would be to die before you actually hit dementia, even though you might be mildly impaired, but still enjoying life prior to that. What's your experience in that?
Sure. We see a direct impact between lifestyle factors and the course of disease progression and delaying the onset as well. So things like diet, exercise, good quality sleep, managing your stress, meaning emotional stress as well, all of those factors can have a direct impact on your risk of developing the disease and also slowing the progression.
So therapy can help both the afflicted patient and the caregivers. So there's this horrible statistic that 1 out of 3 caregivers die before the partner with Alzheimer's, which speaks to the stress issues and the need for taking care of oneself, including some forms of both cognitive and behavioral therapy. So I'm glad you mentioned that because I think that's a critical issue in this arena. Gus, what are your thoughts?
So I think that one of the biggest things now is the opportunity, whether that be through checking cerebrospinal fluid and taking a look at the amount of beta amyloid that resides there as opposed to the brain, hyperphosphorylated tau or total tau in the cerebrospinal fluid as well as the brain. That'll tell us a lot. Even with these results, this is exciting, but it's not the full story. So this is one target that we have at the present time. It looks hopeful because we might be able to intercede a lot sooner. Typically, when somebody gets diagnosed with Alzheimer's disease, they've been walking around with this condition for 20, 25, 30 years. But the problem is we haven't been able to tap into that yet. And whether that be through better neuropsychological tests, I know at Hoag we have the opportunity of utilizing the MCI screen and different tools that can be incorporated for most clinicians, whether it be other factors beyond the amyloid hypothesis. It's probably going to be a solution down the line where we have a multi-pronged approach. But the neat thing is that right now we've stepped where we were. Literally, there's been no advent of any new therapy for the past 18 years. So all we had were 3 cholinesterase inhibitors and 1 NMDA receptor antagonist to help offset this problem, which we know is progressive and neurodegenerative.
I must say those early drugs were used and sometimes misused by physicians, and particularly primary care physicians, because there aren't enough experts like yourselves and neurologists that deal with the neuropharmacology of this disease. So it's great that we have a new drug. That said, that drug is very expensive, and one of the advantages of the clinical trials pathway for these patients to similar drugs is that the drugs are offered free as part of the clinical trials in our institute and around the country. So hopefully folks understanding this a little bit better can take advantage of the clinical trial access for doing what an approved but still very expensive drug has to offer.
Well, that's a great point, BZ, because when you take a look at this new agent that Biogen's now introducing, it's going to be about $56,000 a year for people. That means close to $5,000 a month.
That about buys Lauren's wardrobe every year.
Possibly. I don't know if it quite gets to that. But you know what? When you take a look at the actual math, it's really interesting. There's about 6 million people affected with Alzheimer's disease just in the U.S., right? By the year 2050, we're expecting a doubling of that number. But if you take a look worldwide, we're talking about closer to 50 million individuals. That means that the overall expenditure is about $1 trillion for people with Alzheimer's disease annually. Yeah. So any intervention that might be able to help offset, decline not just with cognition but functionality would be a potential huge boom.
I'm so glad that we have two national experts in this field, that Orange County has, like I said, a rapidly growing senior population, and Newport Beach specifically is the second.
But we have a way of countering those problems, those challenges.
We do, and Newport Beach is certainly an aging community as well, the second largest concentration of seniors after Laguna Woods. So it's a county as well as a national issue, and here at Hoag, we address our community with the best and most advanced care possible, thanks to the two of you. Appreciate your time with us today.
Thanks for having us.
Thank you.